Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today we're talking with Dr. Timothy Snodgrass of Hamilton Physician Group, Convenient Care. Thank you for joining us, Dr. Snodgrass.
Well, thank you for having me, Bobby.
Dr. Snodgrass is a board-certified family medicine physician at the Hamilton Physician Group Convenient Care in Dalton, across from Hamilton Medical Center's Emergency Department, and the Convenient Care in Varnell at 3957 Cleveland Highway. He treats mild illnesses and injuries and performs preventative care. Walk-in care and appointments are also available. So, Dr. Snodgrass, what do you enjoy doing in your spare time?
I like doing outside kinds of things. I like going fishing, swimming, hiking, things like that. So I like the outdoor activities, and I like spending time with my wife and family.
That's great. Now, you are relatively new to this area, I understand.
That's right. I've only been here for a couple months.
Now, there's a lot of great fishing in this area.
I know, but I haven't been yet.
Oh, you'll enjoy it very much. You really will. A lot of bass fishing. I'm old-fashioned. I like to catfish, and there's a lot of catfishing here. There's a lot of fishing, so I think you'll enjoy that very much. What's your favorite part of your job?
I like the variety. I like seeing different kinds of patients, different kinds of problems. I like finding a problem and fixing it and helping patients feel better.
Well, that sounds great. That sounds very good. Now, tell us about Hamilton Physician Group Convenient Care.
Well, the convenient care, it provides non-emergency personalized care to adults and children, which are age 2 and up, and they don't need any appointment to come. And we treat mild illnesses like sore throats and earaches and colds and flus and minor injuries like lacerations and stitches, and we do preventative care too. Physicals, immunizations, and screening things like mammograms, colonoscopies, bone density tests. And we help people manage their chronic illnesses like high blood pressure and diabetes and other chronic conditions.
You know, I have diabetes. I have type 2, and type 2 diabetes is just rampant in this country.
It's terrible. It's terrible. And a lot of people don't understand what the big problem with diabetes is. The higher the blood sugars for the longer the time, the faster your arteries clog. And that's the primary problem with diabetes, is the vascular disease. It clogs up your arteries everywhere.
Well, you're exactly right. And I have had diabetes for 24 years, and I've taken care of it for 1 year. So I've suffered a heart attack, and I have been to vascular clinics and vascular doctors, and so I've lost a toe, so I understand what you're talking about. Diabetes is very, very bad, and you guys take good care of it.
Well, we're hoping that the patients take good care of themselves. I mean, the big treatment for diabetes is the diet and medicine and exercise, and that's the challenge. It's so under controlled, and so many people need better controls to keep their arteries open.
Yeah, I agree with that wholeheartedly. One of the things that I wanted to mention before we take a break is that you can just walk in, no appointment needed. That's important.
Exactly. I mean, people work. They need to take time off to go and take care of their health problems, and it's hard to get off of work to go to the doctor.
Right.
And that's why the convenient care is nice.
So you can go, how late are you open?
We're open till 6.
Open till 6 o'clock, so somebody gets off work at 4, they can go after work.
Right. Now, it's kind of a first-come, first-served kind of a thing there, so you have to take time to come in. But we see people without any appointments. Myself, being a family practice guy, I do see people with appointments, and they can make appointments and come after 4 o'clock if that's how late they work.
Oh, I understand. Immunizations, you guys do that?
Yes, we do. We're doing flu shots, pneumonia shots. We do immunizations.
So immunizations are important. You're a big believer in that.
I am. If you can prevent an illness, prevent the flu, prevent pneumonia, it's way better.
Good. Glad to hear that. So convenient care right there across from Hamilton Medical Center.
Yes, it's right across from the emergency room. The nice thing about it is it's not as expensive as going to the emergency room. We've got weekend care. They're open after hours. We've got a lab there. They can do plain x-rays there. We take most of the insurance plans, and we've got multiple locations around the area. I mean, we've got one in Dalton, Ringgold, Varnell, Chatsworth. So we've got multiple places that people can come for care.
That's great. That is fantastic. We're going to take a quick break. When we come back, we're going to talk about some of the other things that are offered at Hamilton Physician Group Convenient Care.
Caring like a family, fighting like an army. Hamilton Healthcare System is here for you. Armed with a love for our community, advanced care, and personalized service, our commitment to serve with compassion stands strong in this season of uncertainty. You are the heart of all we do. Visit us at hamiltonhealth.com for timely health information and updates. If you're in need of medical care, don't delay. Your health won't wait. Hamilton Medical Center is ready to care for you. We are following CDC guidelines. Patients and guests are screened for COVID-19 symptoms. Those who are suspected to have the virus are treated in a separate area. Plus, Hamilton's high-powered UV light robots eliminate 99.9% of bacteria and viruses on surfaces. Please do not delay medical care. Your health won't wait. As always, Hamilton is here for you.
And we're back with Dr. Snodgrass. Tell me, Dr. Snodgrass, why is convenient care so convenient?
Because there's several benefits there. You don't have to have an appointment to go. The cost is lower than going to the emergency room. We're there on weekends and after hours.
And that's very important.
It is. People work during the week and they don't always have time to come in. So if we're open on the weekends, people can come and get care.
Good.
We've got a lab on site there. We can do plain x-rays at most of the locations. We take most of the insurance plans, including Medicare and Medicaid, and we've got many locations around the area. So that's why.
Now, some of the location areas, some of the places you have locations, I know you have one in Dalton. I've been to that one, but where else?
We've got one in Varnell, we've got one in Ringgold, and we've got one in Chatsworth as well.
Wow. So you're all over North Georgia. That is fantastic. It's great to know about all the different locations and all the different things you guys can do. What's something that not everyone knows about convenient care?
Well, most everyone know that we're there for a walk-in clinic, but not everybody knows that we take appointments too. I work as a primary care physician on an ongoing basis with patients, and I help them manage their chronic illnesses like high blood pressure and high cholesterol and diabetes. So besides being a walk-in place, we take appointments too.
Well, that's important. If somebody knows they can get there at 4:20, they can just call and have an appointment, and you're waiting on them when they get there.
Exactly.
That's the way to do that. Now, you say that you're a family medicine physician. What exactly is family medicine?
We take care of the whole family. We focus on people and their family over long periods of time, and we become part of their family as a family physician. We focus on preventive health care, which means keeping people healthy and avoiding illnesses and disease. We offer treatment for most everything, and if we don't know how to do it, we can refer them out to specialty people.
Well, that is wonderful. And there are so many specialists in the area. You guys are located so convenient. Convenient care. What a great name for that. Treating the whole family, it's got to have a lot of advantages.
It does. I mean, by treating the whole family, we'll know the family history, and we can, during the cold and flu season, that's really an important kind of a thing.
That's true. You talked about being a walk-in clinic. You have walk-in care. Hamilton Physician Group Convenient Care also offers annual physicals and other regular primary care services. It's easy to forget to schedule an annual physical each year. Why is an annual physical so important? And I know you guys do those.
We do, and it helps to find problems before they start. We can catch things early, and if we catch things early, we can treat them early, and people don't have the long-term problems that come from early things. And we can improve your chances of living longer, having a healthier life. And there's about 25% of Americans don't have a primary care doctor. And if you're a part of that 25%, I encourage you to find a physician that you trust. Having someone you can rely on and an ongoing relationship with that physician is really important to your health. And if you're too busy, Hamilton Physician Group and the Convenient Care, we offer weekday and weekend hours.
That is fantastic. And it's like you guys would, at that point, be their family physician.
They can choose us if they want to, or we can see them as an urgent problem there and send them back to their regular doctor.
I got you. So it works either way. Someone who has a physician.
Right.
They can come visit when the physician's office is closed, and you guys have great hours.
Or when their regular doctor's office is full. They send them over to the Convenient Care, and we can send them right back to their regular doctor.
And they bring a note. That way their doctor will know what happened. You guys talk to each other. I know how you doctors are. Y'all are talking to each other all the time.
Absolutely.
And you all be in touch with one another. That is great. I had never thought of that. So if my regular doctor is busy, I can't get an appointment, I can always come to Convenient Care.
Right. And then we take care of the problem and send you back to your regular doctor.
Now, is there anything that we need to do before we come to see you if we're coming to see you for an annual physical?
Yes. If you could review your family medical history, find out what vaccinations you need, if there's any screening things you need, and write down any questions or issues that you want to talk about with your doctor.
Okay, I understand. Let's back up just a moment. We talked about things like sore throats, and you also mentioned x-rays, broken bones. You guys work on folks with broken bones.
Sure. If somebody comes in with if they kick the dog or something and they hurt their foot, we can take an x-ray of their foot and tell them if it's broken or not, put on some kind of a splint or something, and send them off to orthopedics or podiatry to get it treated.
And give them a really good understanding of what's going on.
Yep.
Now, what about blood work? Because a lot of times, having diabetes, I need blood work done. And did I hear you mention that you have labs there?
We have a lab where we can check simple urine samples and pregnancy tests and things like that.
But it's on site.
Yes, and we can draw labs there at the office, and we send the blood test over to the hospital to be run many times that very same day.
Yeah, just right across the street.
Exactly.
That goes right back to that name, convenient. It is so convenient. A lot of great information today. We'll be right back. We've got more with Dr. Snodgrass coming up. Don't go away.
Caring like a family, fighting like an army. Hamilton Healthcare System is here for you. Armed with a love for our community, advanced care, and personalized service, our commitment to serve with compassion stands strong in this season of uncertainty. You are the heart of all we do. Visit us at hamiltonhealth.com for timely health information and updates. If you're in need of medical care, don't delay. Your health won't wait. Hamilton Medical Center is ready to care for you. We are following CDC guidelines. Patients and guests are screened for COVID-19 symptoms. Those who are suspected to have the virus are treated in a separate area. Plus, Hamilton's high-powered UV light robots eliminate 99.9% of bacteria and viruses on surfaces. Please do not delay medical care. Your health won't wait. As always, Hamilton is here for you.
We're talking with Dr. Snodgrass, and one of the things that I have always thought of all my life, and I remember as a child, my parents would work hard to find a good doctor, and then as I got children, I started interviewing doctors. What is a great way to find a wonderful doctor?
You want a doctor who will listen to your opinions and concerns, who will encourage you to ask questions, someone who will take time to explain the problems in simple language that you can understand, that doesn't talk over your head, someone who's board certified and experienced, someone who takes your health insurance, and you can check your insurances to see which physicians are included on your plan, someone who's close to your home or work, and a doctor who knows their limits. If you can find a doctor who knows what they don't know, but say, I don't know what's wrong, but I know where you can find the answer, and send you to someone who can find the answer,
right,
that's a good doctor who knows their limits.
That makes so much sense. Just like in any profession, you've got to find somebody who knows that they need to send you someplace else to a specialist if they don't know the answer.
Right. If that doctor finds a problem and doesn't know what to do with it, they shouldn't just drop it. They should say, I don't know what's wrong, but here's where you go to find the answer. And that's how you find a good quality doctor.
Oh, that's wonderful. And also a doctor who doesn't talk above your head.
Yes.
I think we've all been to those doctors
And
before.
too many doctors talk right over patients' heads. If they can't explain the problem in simple language you can understand, they're trying to make themselves feel better. That's not the point. The point is to educate the patient and tell that patient exactly what is wrong, what the possibilities are, and how we make it better in language that they can understand.
And not just what's going on today, but what can happen to you in the future if you don't do what the doctor says.
Right. And to find a doctor who doesn't make you feel like you're in an assembly line.
Right.
I hate that. It's next, and you feel like you're part of an assembly line. That's wrong. This should be personalized care for that one patient.
You're exactly right. The things that you are saying are things that I think not just myself and you before you were a doctor, but other people that are listening to this program have lived those things in life. When you go to the doctor and the doctor talks right over your head, they get you in and out of there as quick as they can. That's not what you want.
No. The idea is to address the problems that are there in language that patients can understand. That's what you want.
Good. And
not to feel rushed.
Great advice, Dr. Snodgrass. It's great having you on. Let's shift gears. So I want to talk about high blood pressure. A lot of people have high blood pressure. Fortunately, I do not. My father has always had high blood pressure. Let's talk about high blood pressure and why having high blood pressure is dangerous.
Well, blood pressure is the force of the blood against the walls of your arteries. And high blood pressure or hypertension can cause damage throughout your whole body. The optimal blood pressure is less than 120/80, and high blood pressure is defined as 130/80 or higher. About 46% of Americans have high blood pressure.
So that's nearly half.
Right. And the problem is if you leave it untreated, it can cause a strain on your heart, damage your arteries and blood vessels, contribute to plaque in your arteries, restrict blood flow, and all of these can lead to serious problems. For example, in your brain, you can have memory loss problems from damaged and restricted vessels there, cutting down the amount of blood and oxygen that goes to the brain. Strokes. There are two ways that high blood pressure can cause a stroke. The buildup of the plaque of the arteries or a clot thrown from a buildup somewhere else can cut off the blood flow going to the brain, or a weak spot in an artery. If the blood pressure is too high, it can blow that weak spot, and you can leak blood into the brain.
Oh, my goodness.
Right. In your eyes, it can cause eye damage. It can block the blood flow. It can cause damage to your retina, optic nerve. That can lead to complete vision loss. In your heart, it can cause a heart attack. The buildup of the plaque or a clot in the arteries can cut off the blood flow going to your heart. It can cause heart failure, where the narrow arteries throughout the body can stop blood flow from traveling freely. It makes your heart work harder than normal, which can lead to an enlarged heart and congestive heart failure. It can cause kidney damage.
Wow.
The job of the kidneys is to filter the waste side of the blood. So they've got a lot of blood vessels, and the arteries in the kidneys are damaged if there's less blood and oxygen and nutrients reaching those kidneys. They can't filter correctly. And if enough arteries become blocked, your kidneys fail and you end up on dialysis, which is a big problem for my diabetic folks too.
I'm sure.
In your stomach, you can have aneurysms. Aortic aneurysms are common. High blood pressure can weaken the walls of the aorta, and the aorta can become enlarged like a balloon stretching out, and that's called an aneurysm. A ruptured aortic aneurysm, it's life-threatening, and people die fast. In your legs, you can get narrow arteries to the legs. That's called peripheral artery disease. And it can hamper the blood flow going to the legs and cause pain when you walk. Cramping and tiredness in the legs. If it's not treated, it can cause gangrene and loss of a limb. A lot of times, there aren't any symptoms to high blood pressure.
Well, that was my next question. What are some of the symptoms to high blood pressure? If I'm suffering from high blood pressure, I need to know.
Exactly. And that's why they call it the silent killer, because a lot of people don't have any symptoms to high blood pressure. Some people have headaches, or sometimes people feel lightheaded or weak or dizzy, or those kinds of vague kind of symptoms. And the only way you'd know if you have high blood pressure is to go and get it checked. And that's why it's important to go and see your primary doctor.
We're going to take a quick break. When we come back, we're going to talk about a lot of things. We're going to, again, talk about high blood pressure. We're going to talk about tobacco use and other things. So be sure you stay with us. We'll be right back.
If you're in need of medical care, don't delay. Your health won't wait. Hamilton Medical Center is ready to care for you. We are following CDC guidelines. Patients and guests are screened for COVID-19 symptoms. Those who are suspected to have the virus are treated in a separate area. Plus, Hamilton's high-powered UV light robots eliminate 99.9% of bacteria and viruses on surfaces. Please do not delay medical care. Your health won't wait. As always, Hamilton is here for you. Caring like a family, fighting like an army. Hamilton Healthcare System is here for you. Armed with a love for our community, advanced care, and personalized service, our commitment to serve with compassion stands strong in this season of uncertainty. You are the heart of all we do. Visit us at hamiltonhealth.com for timely health information and updates.
And we're back with Dr. Snodgrass, and a couple of things that I wanted to talk about in this segment. High blood pressure is very common. What can be done about high blood pressure?
The first thing we should do is to talk about lifestyle changes. To stop using tobacco if you use tobacco, both the dip and the smoking. To cut down on your alcohol intake. If you drink too much, your blood pressure is going to go high. To lose weight if you're overweight, which is easier said than done.
I understand.
It's tough.
It is tough.
To increase your aerobic physical activity. To eat healthy, whole foods, like, fresh fruits, vegetables, whole grains, low-fat dairy products, lean meats and fish. To limit your salt. If you eat too much salt, your blood pressure is going to go high. And to limit your sweets.
Now, let's go back to tobacco.
Yes.
What is it about tobacco that you feel that is so important that people not use tobacco when it comes to, there's so many things, but when it comes to high blood pressure?
The problem besides the cancers that tobacco causes, and besides the emphysema that smoking causes, it clogs up your arteries fast. There are surgeons who won't do operations on narrow arteries in the legs if people are smoking. So it clogs up your arteries, and that's a big thing that a lot of people don't know. That's why it's so important to cut down on tobacco.
And we're talking about tobacco use not just from cigarettes, but also from
dip.
Dip, yes.
Yes, dip is popular.
What about young people? Are young people still smoking?
Absolutely. Smoking is rampant here. And if there's and the thing is that everyone's friends are smoking. And they'll, let me have one of those cigarettes. So smoking, young people smoke, older people, everyone smokes.
Wow.
And so that's why it's just so important to wean away your tobacco and to quit altogether.
Well, you're right. You're exactly right. High cholesterol. I hear talk about high cholesterol. I had my cholesterol checked. It was 240. Mm-hmm. She said that was out of sight. I got to get it down.
Right.
What are some ways that I can get my cholesterol down?
Ways of cutting down your cholesterol. First, work on your diet. If there are a lot of fatty, greasy things that you're eating, work on cleaning up your diet. Part of the problem with high cholesterol is it runs in families. So you can ask your parents, and your brothers and sisters, hey, does your cholesterol run high? And it could be that you've got a clean diet, you're exercising faithfully, and your cholesterol doesn't come down. And that's the problem that runs in families. But if people have other problems like diabetes, you're going to want to get the cholesterol down. So there are good cholesterols and bad cholesterols. The HDL cholesterol, cholesterol is subdivided into different types. Mm-hmm. The HDL is the good cholesterol, and it helps to prevent heart disease. The unhealthy cholesterol is the LDL.
The LDL.
Right.
Okay.
And that's the bad cholesterol.
Now, what does it do? How does it hurt you?
It clogs up your arteries.
Okay.
It irritates the lining in your arteries, and it builds up the plaque, and that's the problem. So that's
and there's medication for that.
There are. There are medicines to lower cholesterol. And I encourage people, especially if they have chronic illnesses like diabetes or heart disease, to get their LDL cholesterol low enough to where the doctors say you're good.
Now, what's some of the foods, you mentioned fatty foods, what's some of the foods that carry a lot of cholesterol? Is cheese?
Cheese does.
Cheese does?
cheese-
See, I love cheese. I could eat a block of cheese the size of a car battery.
Sorry,
I've
buddy.
always liked cheese.
I know.
But I don't need to be eating a lot of cheese, a lot of
Right.
fatty foods.
Right. Deep fried foods.
Oh, my
Fried
goodness.
foods.
Well, we're in the South, you know.
I know it. And I like fried foods too.
But
yeah.
that carries a lot of the, tell me again, LDL?
Right. The
A lot of
LDL
that-
cholesterol.
The LDL cholesterol, the bad cholesterol.
Right.
Stay away from that.
Right. So some things that you can do. I mean, the problem is the heart disease that comes with the cholesterol and the high blood pressure. So work on lifestyle habits. If you're overweight, work on losing weight. Work on your blood pressure. Fix the high cholesterol.
High cholesterol, so important not to have high cholesterol. And that's something that you can do with the blood check.
Yes. One of those visits with your primary doctor.
Got you. Okay. That's,
Exactly. And make sure that your labs are fasting. Otherwise, if you don't have fasting labs, your numbers will be skewed.
Okay, tell me about fasting. Is that whenever they tell me not to eat after midnight?
Right. Or I tell people you can have supper the night before, water after that. You can have water first thing in the morning. I let people have a plain tea or plain coffee in the morning and then go get lab work done. Otherwise, if you eat, the values that you get on your lab work to check on your cholesterol will be skewy.
Okay, so when you fast, you're going to fast after dinner the night before, and then just don't eat.
And
You
then
can drink water,
Take
coffee,
water
tea.
and take your regular medicines if you need to in the morning or bedtime. But you want to be fasting, otherwise your numbers will be wrong.
Let's talk about COVID-19, and I don't want to spend a ton of time on this.
Okay.
It seems like that's what everybody is talking about. But when it comes to COVID-19, how safe is it to come to convenient care if you're afraid of catching COVID-19?
Well, the Hamilton healthcare system has put measures into place to keep both the staff and the patients safe. When patients arrive, they are greeted by the staff at the door who takes their temperature and screens them for the symptoms of COVID-19. And we follow the CDC guidelines and have put a lot of processes in place to keep people safe, including wearing face masks. The team members who work at Hamilton wear protective equipment. There's social distancing guidance done. We have sanitation stations throughout the facilities, and we stagger appointments to try to minimize the number of people in each area. So those are ways of keeping people safe. And we have a lot of demand for patients coming in to get checked for COVID-19. And those people we bring in through the back of the building and go through the back door.
What a great idea.
Right.
So if somebody wants to be tested for COVID-19, they come in the back door.
Exactly.
They don't have to wait in the waiting room with other people.
Well, there's a waiting section in the back there.
That's good.
For people who want to be tested. But the regular patients who have regular appointments come through their front door.
That is wonderful. That is fantastic. Are you seeing a lot of people want to be tested for COVID-19?
A lot.
Are you?
At our office, we see about maybe 40, 50 people a day who get tested.
Is that right?
Mm-hmm.
That is something else. Wow. Insurance. We talked about insurance. It's important to find a doctor that takes your insurance. And at Convenient Care, you guys take a whole bunch of different
We take
insurance.
most insurances.
Yeah. What about Medicaid and Medicare?
Yes, we do.
That's good, too. I appreciate all the great information. There's been a lot of information in this show. It's just been a fantastic program. Before you leave,
Yes.
I don't want to put you on the spot, but
Yeah.
Is there anything that you can share with our listeners, maybe a word of advice that you'd like for them to remember?
Absolutely. Keep yourselves healthy. If not for yourself, keep yourself healthy and in good shape for the people who love you and care about you and depend on you. And that's a way of showing those people that you love them.
If you're in need of medical care, don't delay. Your health won't wait. Hamilton Medical Center is ready to care for you. We are following CDC guidelines. Patients and guests are screened for COVID-19 symptoms. Those who are suspected to have the virus are treated in a separate area. Plus, Hamilton's high-powered UV light robots eliminate 99.9% of bacteria and viruses on surfaces. Please do not delay medical care. Your health won't wait. As always, Hamilton is here for you. Caring like a family, fighting like an army. Hamilton Healthcare System is here for you. Armed with a love for our community, advanced care, and personalized service, our commitment to serve with compassion stands strong in this season of uncertainty. You are the heart of all we do. Visit us at hamiltonhealth.com for timely health information and updates.
For more information about Hamilton Physician Group Convenient Care, Dalton, call 706-529-3245 or Hamilton Physician Group Convenient Care, Varnell, 706-852-2374, or you can visit hamiltonhealth.com/convenient. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.